Speak to Dr. Marcus Plescia, who's Chief Medical Officer at the Association of State and Territorial Health Officials. He's joining us now via Skype from Charlotte, North Carolina. Thank you for talking to us. So the President, in his latest address to the nation, emphasising, as I said earlier, the amount of testing that is now taking place in the United States. He says it's more than anywhere else in the rest of the world. Following on from the WHO prescription for dealing with this, which is test, treat and trace, how do you think the US is doing at this particular moment?
Well, I think we're having improvements now in our ability to test for the coronavirus, but we got off to it wasn't a very smooth start. There's a lot more testing now. I think we do have enough tests to test people, at least people who are at higher risk, and we hope that more tests will continue to come out.
And how vital, would you say, is this stimulus package that is currently being wrangled over in Congress? How vital is that to the United States' effort to deal with the pandemic?
Well, I think that having adequate resources is going to be very important for dealing with this pandemic. We're in a situation where we're really having to build up capacity in our hospital systems, and we're doing what much of the rest of the world has been doing with social distancing and having people stay home, and that's taken a big toll on the economy and on those people's ability to get by and pay their bills.
Right, and now we focus obviously on the situation in New York State. We've also looked at the other side of the country, on the other coast, the West Coast, where there are quite large numbers of cases. What's happening in the rest of the country, in the in-between of the United States, and perhaps where you are in North Carolina?
Well, initially, the greatest number of cases were in California, Washington, and now in New York and New York City. But we're starting to see now much more cases being reported throughout the rest of the United States, really up and down the East Coast, which is where I am in Charlotte. We're seeing a number of cases in some of the bigger cities, and several of the cities have now put into place much stricter social distancing requirements. The middle of the country, there's still less cases, although we're really starting to get where we're seeing activity everywhere.
And are these other parts of the country, are the local authorities, are they working ahead of the curve, if you like, or are they waiting until the cases are presented before putting into place measures that might help curb the spread?
They're all taking it very, very seriously and beginning to make interventions, depending a little bit on their situations locally and across the state. But we've seen every state take some kind of social distancing has been put into place in every state, and I know that all of the hospitals across the nation are beginning to look at their capacity and their ability to deal with the numbers if we start seeing large numbers of people getting severely ill where they have to be hospitalized.
Dr. Marcus Plescia, thank you very much indeed for talking to us live from North Carolina.